Giant cell arteritis, also known as GCA, is the most common autoimmune disease of the blood vessels. It presents in older adults when the immune system, for reasons we don't quite understand, attacks the arterial walls, causing inflammation in a process that we call vasculitis. Patients present with debilitating symptoms. They also are at higher risk for aortic aneurysms and, the most dreaded complication, vision loss. Prompt diagnosis and initiation of therapy is critical to prevent blindness. At Michigan Medicine, we use biopsies of the superficial temporal arteries in the scalp to diagnose GCA. Though temporal artery biopsy has traditionally been considered the gold standard for diagnosis of GCA, it is an invasive surgical procedure, it is expensive, and it can lead to false negatives even in the most experienced of hands. For these reasons, our field is shifting towards using non-invasive imaging techniques to diagnose giant cell arteritis.
Color Doppler vascular ultrasound of the temporal arteries and their branches has been a major innovation now widely used in Europe to diagnose GCA. A dark rim representing swelling of the vessel wall can be seen surrounding the blood vessel, signifying active GCA, known as the halo sign. Ultrasound has similar diagnostic accuracy to temporal artery biopsy, and in some places in Europe has replaced biopsy as the standard of care. Ultrasound has many advantages. It is non-invasive, cost-effective, easy to schedule, and you can visualize multiple blood vessels in one study. Currently, vascular ultrasound for the diagnosis of GCA is only offered in a handful of places in the United States and is not currently offered anywhere in the state of Michigan. One of the roadblocks to offering this tool is the need for specialized training of ultrasound technicians and radiologists in performing and interpreting this type of study. Our team's goal is to make vascular ultrasound for GCA diagnosis available at Michigan Medicine, and our own vascular diagnostic unit, led by Dr. John Eliason, is uniquely poised to take this on.
The diagnostic vascular unit is filled with great people, great technologists with expertise and a great bedside manner that provide wonderful care to patients at Michigan Medicine. They're also very innovative. When we were looking at making carotid stenting safer, we brought transcranial Doppler into the operating room in an effort to be innovative and make the procedure better. We think that this next innovation of doing temporal artery ultrasound to diagnose giant cell arteritis is a similar kind of innovation.
Funds from the FCVC Innovation Challenge would enable us to send our ultrasonographers to training sessions held in Europe where they can learn these specialized ultrasound techniques hands-on and bring their knowledge and skills back to Ann Arbor.
The introduction of temporal artery ultrasound at Michigan Medicine would fundamentally change our approach to diagnosing giant cell arteritis and caring for these patients. It would spare our patients an invasive procedure while at the same time offering them a rapid diagnosis. If we want to be leaders, if we want to be at the forefront of cardiovascular care, we need to be able to offer our patients these novel and state-of-the-art diagnostic tools.
The diagnostic vascular unit is really excited about this innovation, and we hope you are too.